A visit to the clinic for this woman who has tuberculosis, a disease of the lungs. Her course of drug treatment could last up to 2 years. Reported cases of TB have been on the rise in Indian cities. This charity sees up to 5 new patients a week and hundreds more already diagnosed. But drugs to combat the virus have been in short supply. While adults can be treated, it's more difficult for infected children.
Pediatrics is a special problem, a special issue, because kids need pediatric drugs. And taking some pill and trying to cut it into 8s and then trying to smash it up, you can imagine how inaccurate that is. Not counting the fact that the kid probably can't even get him to take it.
If we are able to achieve bioavailability even...
But now an Indian research institute has come up with a new approach. A patch using nanotechnology, the science of the very small. It would treat TB through the skin rather than orally. Patches placed directly onto the skin containing tiny needles transferring the medicine straight into the bloodstream.
You know, there are 5 different drugs for TB, right? So these 5 different drugs would be put in 5 different patches, or they would be color coded into 5 different patches. The color coding would tell a person which patch to apply at which phase. So we would make it very simple for the person who comes to buy these patches or take these patches from government centers.
22 million people live in Mumbai and 60% of them in slums. Overcrowded and with poor ventilation, they're a breeding ground for TB. Small medical centres like this set up shop in congested areas of Mumbai to treat those with the disease. Once diagnosed, those people that can't get to a hospital rely on these mobile units to continue their course of treatment.
I can't work. I get chest pains and my stomach hurts. Nearly every evening I get a fever. Whether I get my treatment here or at the hospital, it's the same. But it saves time not to go to the hospital when I can get it at this clinic.
A new patch could make treatment easier and more effective, especially in Asia or sub-Saharan Africa, where tuberculosis is most prevalent. But while research suggests it works, it could be years before patients like SUPUR are being treated with nanotechnology. Sohail Rahman, Al Jazeera, Mumbai.